Last year, 44 million people in North America alone suffered from diabetes. This translated into a $300 billion burden on the healthcare system. Furthermore, extensive diabetes-related equipment costs patients between $1,500 and $15,000 per year. However, if patients are not actively self-managing their diabetes, this equipment is essentially an expensive, impersonal unit that neither engages nor encourages patients to self-manage their diabetes. If you think about children, school-age children, who are now starting to take more responsibility with their care, physicians actually try to encourage this self-management by asking them to log their blood glucose readings a minimum of 3 times per day in a paper-based logbook. Failure to heed this recommendation results in the Canadian healthcare system paying $50,000 to $150,000 per person. However, primary market research reveals that approximately 90% of kids actually don't do this. But let's be real, do kids even use paper these days? That's why KiDi SMS was designed, a creative, interactive online platform which uses gamification as a way to incentivize self-management. When the child logs a minimum of 3 readings in a given day, a game is unlocked. The game, however, is only available until midnight. So the child has to log an additional 3 readings the following day in order to unlock another game. If users have any diabetes-related questions, they can send a message directly to their physician. KiDi SMS has already been implemented for use at McMaster Children's Hospital. Our pilot study revealed that 82% of patients met the goal of logging a minimum of 3 times per day. In addition, an astounding 91% of users reported that they felt more motivated to self-manage their diabetes using KiDi SMS. While our program and pilot study has focused exclusively on children with type 1 diabetes, we plan to expand to the entire diabetes market. We've even had preliminary discussions with Bayer to pair our program with their glucometer. This partnership would benefit these companies because we would be able to provide new data analytics. In addition, we would increase their test strip sales. So our target customer would therefore be the glucometer manufacturers, such as Bayer, Abbott, La Roche, and the like. By charging a conservative 5% of the average test of test strips and penetrating just 1% of the diabetes population, this translates into $24 million in revenue annually. Our user base has increased by 60% in the past year, and we aim to grow this number by an additional 40% by the end of 2017. We're confident that with the guidance of our mentors, pediatric endocrinologist Dr. McMaster and pharmaceutical veteran Dr. Bainey, that we will be able to improve the quality of lives of patients with diabetes. We are so grateful to be here on the Spectrum platform and plan to use the majority of funds raised tonight for the beta testing and additional trials. With our proven track record and your financial support, KiDi SMS will radically change the diabetes self-management landscape. Thank you.